The 3M Veraflo Cleanse Choice Complete Dressing is specifically designed for use with 3M Veraflo Therapy provided by the 3M Veralo Therapy unit. It's designed to facilitate removal of wound exudate and infectious materials. Veraflo Cleanse Choice Complete Dressing Kits are available in medium and large sizes to accommodate various wound sizes and minimize waste. The Veraflo Cleanse Choice Complete Dressing is composed of a single piece of foam with 2 layers. A wound contact layer with 1 cm diameter by 8 mm deep holes, and a smooth layer without holes. The foam is less hydrophobic than other VAC therapy dressings, which helps facilitate even distribution of topical wound solutions. The Veraflo Cleanse Choice Complete Dressing also has increased tensile strength and may be used with explored tunnels or undermining where the distal aspect is not visible. The medium-sized Veraflo Cleanse Choice Complete Dressing Kit contains a medium-sized single piece of foam, a wound ruler, 2 sheets of 3M Dermatac Drape, and the 3M VAC Veratrac pad, an all-in-one system that incorporates tubing for fluid input and tubing for exudate and fluid removal through a single pad interface. The large-size kit contains a large-size single piece of foam, a wound ruler, 2 sheets of Dermatac Drape, and the VAC Veratrac Duo Tube Set, which consists of 2 pads, the Instill pad for fluid installation, and the 3M SensorTrack pad for fluid and exudate removal. Before applying a new dressing, remove and discard the previous dressing per institution protocol. Thoroughly inspect the wound to ensure all pieces of dressing components have been removed. Ensure debridement of all necrotic, non-viable tissue, including bone, eschar, or hardened slough, as prescribed by the physician. Perform a thorough wound and peri-wound area cleaning per physician order or institution protocol prior to each dressing application. Protect fragile or friable peri-wound skin with medical-grade transparent film or hydrocolloid. Ensure adequate hemostasis has been achieved. A non-adherent material like the 3M Adaptic non-adhering dressing can be used prior to foam dressing placement to protect delicate structures such as blood vessels or to facilitate future dressing removal. Assess wound dimensions and pathology, including the presence of undermining or tunnels. Do not place any foam dressing into blind or unexplored tunnels. Size the dressing as needed to allow gentle placement into the wound without firm packing of the foam or overlapping onto intact skin. Gently place the foam into the wound cavity with the whole side down, covering the entire wound base and sides, tunnels, and undermined areas. As compared to traditional 3M Granufoam dressings and 3M VAC Veraflo dressings, the Veraflo Cleanse Choice Complete Dressing Foam is approximately 3 times denser. Therefore, there may not be need to fill the depth of the wound to the wound surface. Remove the release liner to expose adhesive and hold the drape by the handling bars. Place the adhesive face down over the foam and apply the drape to cover the foam and intact skin, ensuring at least a 5 to 7 cm border of intact peri-wound tissue. While holding down the edge of the drape, remove the perforated handling bars from the drape and pat down to ensure an occlusive seal. Smooth any wrinkles or creases in the dressing to prevent leaks. If needed, peel back and reapply the drape during the initial placement. If a leak source is identified, patch with additional drape to ensure seal integrity. Choose an appropriate location for the VAC Veratrac pad. Pinch the drape and carefully cut out a 2.5 cm hole, not a slit, through the drape. The hole should be large enough to allow for the input and removal of installation fluid and/or exudate. Next, remove both backing layers 1 and 2 from the pad to expose adhesive. Place the pad opening directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. When using the large Veraflo Cleanse Choice Complete Dressing, apply the VAC Veratract Duo Tube Set. Choose the Instill Pad application site. Pay close attention to fluid flow and tubing positioning to allow for optimal flow. Pinch the drape and carefully cut a 2.5 cm hole, not a slit, through the Dermatac drape. The hole should be large enough to allow for the input of installation fluid. The Instill Pad has a central disc and a surrounding outer adhesive skirt and smaller diameter tube. To apply, remove both backing layers 1 and 2 to expose the adhesive. Place the pad opening in the central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. Now, choose the pad application site for the sensor track pad. Pay close attention to fluid flow and tubing positioning to allow for optimal flow. Pinch the drape and carefully cut a 2.5 cm hole, not a slit, through the Dermatac drape. The hole should be large enough to allow for the removal of installation fluid and/or exudate. Apply the sensor track pad, which has a central disc and a surrounding outer adhesive skirt. Remove both backing layers 1 and 2 to expose the adhesive. Place the pad opening in the central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. Document the total number of pieces of foam used in the wound. You are now ready to connect the Veraflo Cleanse Choice Complete Dressing to the VAC Ultra Therapy System. Please watch the VAC Ultra 4 Therapy System video or the Veraflo Therapy with 3M Smart Instill feature video for further instructions on initiating Veraflo therapy. Remember to keep therapy on for a minimum of 22 hours per day. Dressings should be changed every 48 to 72 hours, but no less than 3 times per week or as ordered by the clinician. For more product demos and application techniques, visit 3m.com.